Hello, everyone. Welcome to our UNSHAME Kentucky webinar, Black History Month, addressing substance use disparities in BIPOC communities. My name is Ashley Riley. I'm the program coordinator working on this campaign. I reside in Colorado, but Kentucky has a very special place in my heart, and I'm also a person in recovery. So we're just going to go over some housekeeping first. The webinar will be recorded and made available on the UNSHAME Kentucky website. It will also be on YouTube and posted to our social media channels. It'll be posted on Facebook at some point soon. All attendees will be muted, and please use the question and answer panel at the bottom of your screen to ask questions. The chat is also available for general commentary, just will not be moderated as closely. Our interpreter, Missy, will remain spotlighted throughout the webinar. To adjust your view and see all speakers, panelists, click the view button in the top right corner of your screen and then select speaker or gallery. Users can also select a side-by-side view. For closed captions, click the CC Show Captions box in the bottom toolbar. So here's our agenda, just did a little housekeeping, and then I'm going to go into a little discussion about what UNSHAME Kentucky is and tell you more about our campaign. Then we will introduce our topic and our panelists, and we will have a discussion until about 15 of, where then we'll open it up for question and answers, and then close it out. So UNSHAME Kentucky is a webinar series in partnership with the Kentucky Opioid Response Effort, which is CORE, and also Shatterproof. Special thanks to Missy Miller for her ASL interpreting with Louisville, Kentucky services, and then Lisa Colston with closed captioning services. I'll be providing a brief overview of the UNSHAME Kentucky campaign, what our approach is, and then we'll get moving into our presentation for today. So UNSHAME Kentucky is an evidence-based behavior change intervention aimed to reduce the addiction-related stigma held by Kentuckians. The campaign is delivered by Shatterproof, and we are a national nonprofit committed to ending the addiction crisis in the U.S. in close partnership with CORE. The project is supported by CORE through the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, under a SAMHSA grant. The intervention has three main objectives, and first we want to increase knowledge about opioid use disorder. So we're trying to show that recovery is not only possible, but it is probable with proper support. And then we want to improve attitudes towards those living with and or in recovery from opioid use disorder. And lastly, develop Kentuckians' understanding of the disease so people can better support loved ones with OUD. So we have a three-pillar approach, evidence-based approach, and sometimes people ask, well, what is that? So first we have community connection, which is super important. We partner with community-based organizations across the state. We'll start with a needs assessment. This will let us know the areas we need to address. We also have a community impact committee made up of people who reside in the state, so they give a lot of insight on the campaign, maybe the areas we're hitting, where we can improve, and how everything is being received in the state. So second, we have story sharing, which is an integral part of our campaign, and why it's important is to put a face to the disease. We collect and share stories of people in recovery, people who have friends or family in recovery or may have lost someone to the disease, and then also treatment service providers or people who work in the field. So what we have been shown is that this creates a much better connection between those affected and the general public, which ultimately increases empathy and understanding among the general public. And then our last piece is our educational component, which we put on through these webinars. This helps us use knowledge from our CBOs, so our community-based organizations, and knowledge from our community impact committee and other community members to figure out what are the exact messages we need to be putting out. And then we'll create webinars on these topics to educate the general public. So this is just a brief overview of our campaign. If you have additional questions, you can find more information on unshameky.org. And also you can send me a direct email, which will be provided at the end of the webinar. So now we're going to be moving on to our presentation called Black History Month, Addressing Substance Use Disparities in BIPOC Communities. The goal of the February 2024 UNSHAME Kentucky webinar is to create space for Black Kentuckians to share about the topics that are often seen as taboo in the wider substance use space. We'll be exploring historical trauma, the criminalization of drugs in the Black community, and the importance of culturally relevant care, to name a few. Participants will take a journey through the experiences of BIPOC communities, both historically and currently. By the end of the webinar, participants will understand effective ways to support substance use disorders in BIPOC communities. Now I'm going to introduce our moderator, my colleague Jody McIntosh. She has an MPH and is a dynamic public health leader with an extensive history working with underserved and stigmatized populations. As the Director of Community Engagement for the National Stigma Initiative at Shatterproof, she provides oversight and strategic execution of statewide community engagement efforts in Georgia, Kentucky, Michigan, Oneida County, New York, and Pennsylvania to amplify campaign messaging and ultimately generate measurable shifts in addiction stigma reduction. I'm going to pass it over to her while she introduces our amazing panelists who are going to be speaking today.
Thank you so much, Ashley. I'm going to go ahead and highlight our panelists. Give me one moment. Okay. Everybody's here. We're ready to go. So first up, we have Sophie Drye. Sophie is a 33-year-old woman of trans experience. She was born in Louisville, Kentucky, and raised in the West End. Sophie actively used heroin and fentanyl for 12 years and now has been in recovery for 3 years. She's a peer support specialist at Voices of Hope in Lexington, Kentucky. The grant she's currently working on works with the BIPOC community. Sophie's newfound purpose is helping to destigmatize substance use disorder and helping those who suffer from it build recovery capital and put their substance use disorder in remission. Her hobbies include walking her dog, Brody, reading, and watching reality TV. Welcome, Sophie. Okay. Next, we have Jarmichael Harris, who is the founder, Engage Recovery, and director of Scholastic Recovery for Addiction. Jarmichael Harris, MSLCAS, goes by he, him pronouns, is the founder, CEO of Engage Recovery, and currently serves as the director of Scholastic Recovery for the Addiction Professionals of North Carolina. Mr. Harris is an advocate for the expansion of recovery support resources for underrepresented populations, both regionally and nationally, volunteering his time on several boards. Mr. Harris has spent the past decade working in substance use treatment and recovery supports, working with adolescents and young adults, and advocating for a more expansive recovery-oriented system of care. He's a two-time alum of his beloved East Carolina University, where he also serves as adjunct professor. He's raised in Salisbury, North Carolina. And Mr. Harris enjoys being outdoors and taking in everything the great state of North Carolina has to offer. Welcome, Jay. Next is no stranger to this campaign, Shrita Walden, who is the executive director of the Kentucky Harm Reduction Coalition. Shrita Walden, a mom of two and a true advocate for her communities, is noted as an expert in the field of substance use and prevention, with experience spanning over 16 years. When meeting Shrita, one may walk away experiencing a sense of hope, love, empathy, as well as accountability, responsibility, and a healthy dose of humility. As a licensed clinical alcohol and drug counselor, Shrita understands the importance and value of leaning into tough conversations as a means to get to the solution. Her passion and drive for all humankind is the fire that gives her the energy to persevere, in the face of presumed hopelessness. Shrita acknowledges that her entire life has been centered around harm reduction. However, the practice of intentional harm reduction became a reality when she accepted the executive director role at Kentucky Harm Reduction Coalition. From speaking engagements with the Commission for Opioid Abatement at the Attorney General's office to being a lead speaker at the governor's podium and a number of national summits and conferences, Shrita's influence and presence in these spaces has been recognized as an essential and needed voice at tables to influence changes in policies, regulations, and effectively challenge antiquated belief systems that perpetuate the state of health disparities in marginalized communities. Welcome, Shrita. And lastly, we have AJ Kenley. AJ Kenley is the business office manager for Journey Pure Lexington, as well as an adult peer support specialist. As the business office manager, AJ is the first person anyone sees walking into treatment. She makes sure that all feel welcome. And as a peer support worker, she shares her own experiences with others in a manner to make all areas of treatment as accessible as possible. AJ explains consents, documentation, and program guidelines to clients, and also assists in establishing appointments for therapy, groups, and medication management. AJ shares resources with clients to make sure they are receiving the best care available. Everyone who enrolls is assigned a recovery coach that maintains contact with them for their first year. AJ is a mother of two and a person in recovery since February 15th, 2015. Welcome, AJ. So to kick things off, we're gonna just dive right into it. And this question specifically, we'll start out with Shrita and Jay, and then AJ, Sophie, if you have things that you want to chime in on, that's perfectly fine. So what historical events, like the war on drugs, have disproportionately affected Black communities? And can you tell us more about this?
Thank you, Jay. So the war on drugs, thank you for asking such a profound question first. The war on drugs, as we know it, is a big failure of our system to address a significant health care need. The way that I like to frame it is it's not just the historical, there are many historical events. It is not addressing the issues that are rooted in the disparities that the Black community continue to suffer from. So substance use from a framework of harm reduction is something that is a part of our community. And we know with the development of the war on drugs that it became a war on people. So we didn't get a chance to address the issues of disparities in the healthcare system. Black members from the Black community, an ability to address mental health care needs, trusting the system is rooted in systemic oppression, is rooted in racism. And I think that's where we fail to have a conversation that is not just the actual event, it is the life and how we live as Black people in America. You know, if you're constantly living in a state of survival, if you're constantly living in a state of flux where you're not getting your basic needs addressed, you know, if we're looking at the ACEs and we continue to see that the Black community, for instance, let's talk about substance use. We continue to see the rise of overdose deaths continue to rise, like the numbers last year that were shared in June of 2023. We had a 5% decrease in the state of Kentucky of overdose deaths, but it only impacted one community. It was the white community that had the 5% decrease in overdose deaths. But when we looked at the Black community, we had an 8.9% increase. And so when I think about historical, I'm thinking about, well, we're suffering from being this disproportionate space being here that we have not been on the front end of addressing just say no. So someone said just say no, but it was just lock them up. So when we look at historically what's happened in the Black community to address Substance use and prevention and the disorder of substance use disorder, it's been, well, we've seen an increase of incarceration in the Black community. Instead of people going into treatment, we've seen an increase that, we got an increase of Black people being incarcerated, not being able to go into treatment, and not just not go into treatment, but have sustainable treatment or effective treatment. So when I think about that, it's not just the event itself, it's just that we're not a part of addressing how to improve our healthcare and how to address the needs of the Black community. And then I'll pass it on to Jay to add.
Yeah, well, first off, thank you for having me here. I feel like I'm an outsider amongst all of these Kentuckians, and so I'm just really excited to be here in that regard. But I think you hit on something very important, which really, I think the common thread that you're referring to there also, right, is medical apartheid, right? Like historically, all the way back to the transatlantic slave trade, Black people have been treated a certain way when it comes to our healthcare, and substance use is a part of that system. And the war on drugs has only exacerbated that and continued to kind of pile on. And for many of us, the treatment that we do receive is mass incarceration, right? And so we know how subpar that system is, and how it's ultimately part of a larger system that's all tied back into this idea of medical apartheid, going all the way back to the slave trade, when the father of gynecology, right, was a slave owner who utilized his enslaved women to experiment on, quote unquote, right? And so when you look at it in that context, it's like, of course we're here, because this is all that this country has known. And I hope to kind of touch on some other pieces about that when we get into some of these other questions.
Thank you both for kind of laying the foundation with some of the history on how we ended up here. I think sometimes there's a disconnect with that, right? And folks thinking this, just started in the 80s with the crack epidemic, but really it goes back much further than that. And it's kind of really ingrained in the history of this country in particular. AJ or Sophie, did you all have anything that you wanted to add to this? If not, we can move to the next question. Okay. The next question is, what barriers exist with being culturally responsive for BIPOC communities?
And I think it's a continuation of this conversation. So I love the flow of the questions, right? The barriers, like I like the way you talked about it. The answer is the solution is to incarcerate, to lock people up. The barriers are that I think we talk about this cultural competency, and I've been on many platforms and discussions where, it's like I need to learn to understand, but I don't think we talk about cultural safety or cultural humility, cultural engagement. It's not good enough just to say that I have an increase of Black clients coming into my agency. It's more of, how am I addressing the needs? Do I have people from the community representing the communities that we serve to understand the barriers? I mean, I was just on a call talking about sustainability. We're not looking at how do we keep individuals, like Black individuals, in care. Well, the first thing is to understand that they're coming with a backpack, a luggage of so many issues: transportation, access to support, family support. We have a system in place that here in Kentucky, Child Protective Services, that have these requirements and expectations of our Black families that go into treatment. And then we say, well, not only are you going to have to go to work, but for 28, 30-day program, you need to make sure that you have someone that can help you get your kids back and forth to school. They can stay with a parent. They can help. And I'm like, well, did you identify first if this person has a circle of love? And understanding that in the Black community, the language we use, right? My cousin may not be my blood relative. My cousin may be a friend that I grew up with, and we grew up on the same block, and I treat them the same way. So this cultural part is understanding, where does this person come from? And the other thing, especially that's unique here in Kentucky, is I often like to tell people I'm Black, but I'm Black from Chicago, Illinois. I'm not Black from Louisville, Kentucky, but I live here. So identifying geographically, what's the temperature? What's really going on in this community? Understanding that people aren't being, we talk about, microaggressions in workplaces, but we don't talk about it in the treatment and recovery world, right? This client is showing up, they're angry and they're aggressive. Did you check in to see if this client has to go through a neighborhood where there's a lot of violence? Did you talk to this client about who's in their home? If they have a partner that's incarcerated and they've been trying to raise their 5 children on their own, and they have the justice system, the legal system involved, like what is this client coming to the table with? So I think, the barriers is that we have systems of care and we say it's blanket for everyone. And that is so not fair. It's not fair to look at the client, look at a Black client and say, well, you're not doing well, you're not successful because you are not falling in line, when what the shift needs to be, the paradigm shift, and the way we need to move forward, if we're looking at the solution, is our care culturally appropriate? And that is where I think we have the fallacy. And that's across not even just addiction treatment or substance use disorder treatment and recovery. That's in all systems of care as far as healthcare goes. We are not equipped, and we don't equip our teams and our staff and the people out on the street to be able to meet people where they are and understand what that really looks like. And it's going to be unique. We got a cookie cutter approach. We also have the lack of monitoring of our systems. We on this call, we can all talk about our insurance, and I have my annual that's coming up and it's covered under my insurance, and I can only do it so many times, right? Once a year. Dental, you can get your cleanings twice a year, right? When it comes to substance use disorder treatment, we don't have this monitoring system. You can go in and you can go into treatment, and other people with lived experience can speak to this, but you can go into treatment so many different times. They don't really follow up to see how successful it was. It's usually brought back to you where you're being terminated because you didn't do it, versus how did this system operate? We don't hold the systems accountable to operate efficiently. We hold the individual accountable. And the last thing I'm going to say is, when it comes to the legal system jumps in and tells the clinicians how to respond to the client. Like, we're backwards in it. They're the ones who set the tone and the directive. And the fact that we have a legal system that are putting prevention and treatment steps in place, where someone has to go into court and say, I have a problem, so I can be in a deferment program where I can have my sentence decreased. And I'm like, how does that work for the Black community, where we already struggle within our own community to address our own substance use issues? We don't even talk openly about it culturally and in our families. And now you're telling us the only way we can get the benefit of the legal system being able to give us this additional resource of reducing time is I have to go in and openly admit on my first day that I want help because I have a problem. That is so unfair. The system was not created for us to be successful. The system was created for us to be dependent. And that's just it.
Jay, I don't know if you had anything to add to that.
No, just agreeing, and I have some things, but I really would like to hear AJ and Sophie's perspective as well.
Absolutely. So going to Sophie and AJ, could you talk about the disparities in access to addiction treatment services in BIPOC communities? And Sophie, if you want to share about your personal lived experience.
Personally, from my lived experience, what I've experienced is from education to employment, income and home ownership. The Black community has faced a lot of inequalities, but one that has always stuck out to me is the access to the same quality of healthcare as our white counterparts. I can't speak for all Black households, but I come from a household where I was raised by a young mother who was raised by a young mother who was raised by a young mother. So we weren't having these conversations about insurance or primary care physicians. And I remember the first time I sought out treatment, I went to the emergency room because I thought that that's where you went when you had something going on. I kind of felt like I always knew that this my substance use disorder was a disease, and both parents of mine suffered from substance use disorder. So I would see when they would get locked up or be on parole, having to go to meetings and things. So I heard the terms growing up, especially with my mother. So more to say. But when I went to the emergency room when I very first realized I had a problem, I was sent to the healing place, and I'm not knocking the healing place. The healing place works for a lot of people, but that tough love, trudge it out kind of approach to recovery doesn't work for everybody. And what I was noticing is that my white counterparts were able to use the private insurance that they had from their parents to, go to a rehab somewhere where they didn't know anybody, where they could really take time to breathe and focus on themselves. And also, I remember when the Affordable Health Care Act came around, there wasn't access to MOUD. And generationally, in the 80s and the 90s, there was a cocaine and crack epidemic, but my generation, it has been a very big opioid epidemic. So not being able to have these medications that could put my substance use disorder in remission, because my insurance and my it's all tied into money is what I'm trying to say. But I do remember as time went on, I could go to places like JDAC, which is now called Centerstone, but there was a $50 intake fee. Me, as a young person who was after I was 18, the check stopped. My aunt told me I had to leave. I still didn't know about insurance. And I remember there was a $50 intake that you needed to do. Funny story, my mother called a news station, and they were doing a follow-up story on substance use disorder. And she called them, and they came to our house and they interviewed us. And basically, my mom went on the evening news asking for help with the intake fee. It's not like that anymore, but I do remember in the early days of my addiction, what treatment was like, because I didn't have private insurance. But yes, there's definitely a gap in the quality of the services that I've experienced. Yeah. And then also the stigmas from family. It's not what you do, it's how you do it. There have been a lot of things that I think that keep us as a Black people from seeking help. We're told not to trust what everybody says, pray it away, things like that. So there's a lot of stigma and things that I feel like we're still overcoming, that keep people from seeking help.
Thank you for sharing, Sophie. AJ?
For my personal experience, just being biracial in the community, for me, it was that my substance abuse disorder was criminalized more so than it was being addressed. So although I suffered from all these things, it was easier to place me in incarceration and seek medical care while being incarcerated, which again, as anyone knows, I'm labeled as a Black female once incarcerated. But then when I'm out in the real world, learning to live without having access to insurance or only having insurance while I'm pregnant and that being affordable. So again, lowering the standard of care, like we can only do so much for you while you are reproducing basically for society. And learning how to navigate that system, like being without insurance and just learning how to live on the day-to-day basis. Where is the free clinic? You make too much to offer, work insurance, but not enough, or too much to qualify for Medicaid, but not enough to qualify for a commercial policy. So automatically finding yourself in that balance. Is it safer for me to go to the doctor, or do I need to provide food for my family first? And limiting those accesses to get into treatment or even be responsive to going and asking for help, just because I'm like, if I ask for help, are you guys going to incarcerate me again? Or is it going to be something that we can address? Even more so, like I can remember being incarcerated for the amount of time that I was incarcerated for, and seeing other people coming in with the same things, like my white counterparts, again, because I'm incarcerated and I'm labeled as a Black female. So these people coming in, and it was like, hold until treatment bed available. So I'm like, immediately, these people are getting access to treatment once they've been criminalized. But it was like, time to serve until you serve out. And then it was like, hey, we can offer you this, and continue to keep you in the system. Like for myself, it was learning to live outside of the box. I'm a graduate of the Fayette County Drug Court, in which I was able to get some skills to be like, hey, this is how you live life outside of incarceration, but we're going to keep you kind of in this system of having this criminalist activity. And so you can learn to maybe address this. Like I remember having the conversations at my father's house about how to interact with certain things like the police or medical or any of these things. But being at home at my mom's, it was like, you're fine. Or growing up in the household where it's like, if you don't have a fever, like, then you're okay. If you have a small cough, here's some medicine, you're going to school anyways. And, just not really addressing like what is actual illness. As far as the disparities about being culturally responsible, as Sophie and Shrita and everyone had shared, like what is accessible even for treatment options. If I were to go through and look at half of the treatment communities, how many of these people are actually Black people getting treatment for any substance use disorder, and what is acceptably a Black substance use disorder. Going in as a Black female who suffered from a heroin addiction was not supposed to be talked about. I can remember when my father, who is, the Black male in my life, was like, found out that I was an IV heroin user, that it was unacceptable that Black people didn't do that, so just finding out what is culturally appropriate and having an open discussion that, again, anyone can suffer from substance abuse disorder. It's not this man's drug or that man's drug. It's anyone. Instead of labeling more so what is acceptably, and opening that same access across the board. If we care about these people and we want things to stop, making sure that everyone has that same access to treatment. If I'm going to give this white person this treatment, I will also give, anyone with insurance, without insurance, the same continual care.
Wow. Thank you both for sharing and touching on some of those things. AJ, it stuck out to me what you talked about was the acceptable drugs. Like what's okay for a Black person to be doing or not be doing, even within this already stigmatized condition of substance use disorder. It's like the stigma, it's just kind of layered on. Okay, we're going to answer, y'all have some great questions coming through. Thank you so much. Keep them coming. We're going to answer some questions that have come through in the Q&A. One came through from Megan that says, are there regions in the state where we're seeing care deserts? So pretty much areas of the state where there's a lack of care options. And then do these areas correlate with areas with communities with larger BIPOC populations? And then the follow-up question is, where can we focus on advocating for more care options? So Ashrita, I'll start with you, and then we could see if others have input.
Absolutely. So great question. And unfortunately, the answer is going to sound a little dismal, right? Because they're significantly widespread throughout Kentucky. And I don't know if that's surprising to a lot of people who may be clinicians on here, right? You know, the reason why we're seeing the that is a great term, Jay, care deserts. I want to write that down as we talk on policy, right? We don't have a lot of spaces. I know in Louisville there's, you know, smaller outpatient programs. One specifically that I know is doing a really good job because they now have DUI classes, is New Leaf Clinic here in Louisville. And we have smaller organizations and smaller nonprofits popping up like that. But the problem is we don't have the financial support and the capacity of staff. If you go and look at how many licensed clinical alcohol and drug counselors exist in the state of Kentucky, you would be it'd be very disheartening to see that we do not have a significant amount of clinicians of color engaged in our work. And one of the issues and the reasons why we don't is that the barriers to being able to become a certified alcohol and drug counselor. So we're looking at the layers of access to us even being certified to do the work. So if I have barriers to being able to get the education that I need, the support financially, then how can we get people out there? We're always talking about training, but how do we get to hire more clinicians? Because the places that I speak to, the organizations, the treatment centers, they're not very equitable right now, and they don't have a balance of, diverse staff, because it's hard to find the supportive people of color because we are lacking being able to get the training and support to get the degree that we need. So it's not that. And then it's not the accountability and the push from our systems, right? So if we have policymakers and we have people at the top who are saying, hey, I'm going to give it to this organization, I'm going to give funding and support, then why haven't we challenged these organizations to help support preparing people to become these things that we need in the community? Someone, I think there was an anonymous question that actually coincided with that. And I know that we have another panelist that's going to share, but, you know, they asked for recommendations or suggestions on best engaging, how to engage these communities. We have to have people who represent these communities. We cannot get over that. We can't get past that. You know, and in the recovery world, there's a lot of people who have done the anonymous groups like AA and NA, and we talk so much about how we go out. And I want people with lived experience to talk about this, but how are you attracting people when you don't have the people who have the experience to speak to those things? So we can't ignore it. The other term, I don't like a lot of terms, but the other term is we keep trying to do the same thing, looking for a different result. And that's what I think we keep trying to do. We're like, push more and more treatment. We've had significant upsurge of new treatment programs, new Suboxone clinics. And I have not seen a change in policies around how to employ people and bring people on. We have not changed how our licensing boards. So it starts at the top, our licensing boards. We have people who have backgrounds because of their active substance use disorder and the things they had to do to survive. We have still stipulations in place where people still have to deal with their background, so they're not being employed, because even though we have second chance, there's still these areas where we're not sure. And I know that you kind of segued off of it, Jody, but then you opened up about drug culture. Let's not talk about drug culture, right? Because there is a culture within drug use. We deal with that with harm reduction. We're able to provide syringes for syringe service program, but the new data just show that we have an upsurge of Black and Indigenous folks who are dying from overdoses, who are not using syringes. They're using smoking, they're using the smoking kits. They're using ways to inhale. And we're not permitted in this state to provide those supplies at our syringe service programs and at our other harm reduction programs. So we're not able to engage. But then we just saw the 5% decrease in overdose fatalities, and we saw the decrease in transmission of HIV and Hep C because we've been providing syringe service programs. So trying to get our leaders, our policymakers, our leaders in the community to recognize that we're discriminating on drug use and on what people use. We're discriminating on route by saying that, well, that's not harmful. And I'm sitting here saying there's a lot of harm with smoking. There's a lot of things and infections. So just taking a look at the fact that we have to start holding the people at the top accountable to release and stop being gatekeepers over how we engage and what we need to do, especially when it comes to prevention and harm reduction.
Thanks, Shree. I'm going to pass it to Sophie.
I just wanted to throw out there, I don't know about any care deserts, but I do know that women in general, there's not enough out there for us. There's not very many places that women can go for treatment service, or not so treatment services, but after treatment, like sober living houses and things of that nature. There aren't enough just for women. Yeah, we have a lot for men and we have a lot for couples, but there aren't a lot of programs that focus just on the women. And I know now that recovery is so big, and different people are opening up different things, as far as numbers go, I guess filling up a house full of women isn't going to be as easy as filling up a house of men. But I've noticed from my experience, there aren't very many programs for just for women. And that's pretty much all I wanted to say about that. Yeah.
Thanks, Sophie. We had another question that says, can you all speak to the importance of centering Black voices, Black experience, and Black knowledge in relation to how to effectively address substance use disparities amongst Black folks? I'm going to pass that to Jay to start us off.
Yeah, it's funny, right? Because there's a SAMHSA book, Tip 59, I believe it is, on cultural competence. And if I'm not mistaken, it's in there that 50% of people of color who show up for their first appointment don't show up for the second one. And it's like, wow, right? When you think about all the barriers it takes just to get to get into therapy, whether it be individual or even finding that bed, right, that we keep talking about is always elusive. What's the barrier that is keeping folks from actually engaging? And I think a huge part of that is, one, not seeing people on the other side of the counseling room that look like you, but then at the exact same time, understanding, and I come from a clinical background where I was one of maybe 5 Black men in my entire program for 2.5 years. And so we have these thought leaders, right? Erickson, Floyd, Gestalt, all of these different modalities that we learn about, usually taught to white women, and then they're expected to go out and serve the world, right? And it doesn't work that way. It just doesn't. We're the conversations that we're having right now about how all of this is not working, I think that has a huge part of it. And so one of the things that we have to do in centering voices is lifting those in the community that are doing the great work, coaching them into training programs, and also providing them platforms like this, right? I love to see the AJ's here. I love to see Sophie's here and Street is here. You are absolutely amazing in what you do, in the way that you are articulating the challenges that we have to deal with on a daily basis. But we have to keep centering those voices and ensuring that those that are most affected by the issues are at the table for the solutions.
Love that. Love that. And then the last question in the Q&A we have is from Meredith. It says, how do you suggest we continue this conversation and engage with BIPOC communities beyond Black History Month? And I think that's like a trend we see all over society. It's like Black History Month is when Black issues are kind of pushed up to the forefront, and then it's like, okay, we're back to normally scheduled programming. But how do we keep these conversations going as part of larger conversations as far as engaging with BIPOC communities? And anyone can chime in on that.
I think that, I'm sorry.
Go ahead, Sophie.
Okay. I think that us, like people, me, you, Sharita, Jay, we need to continue to be the face of these issues, and when we're engaging with people in our communities, let them know you can do it too. I think a lot of times people see people in these clinical and peer support positions as like some kind of authority, but I think that we need to let people in our communities know that this can be done by you as well, and give them that encouragement that sometimes that they need.
Anybody else have any thoughts on how we can? Okay, go ahead, AJ.
Oh, Sharita, did you want to go? Okay. I think one of the other key points about doing this is, making sure that there are more of our faces in the presence, not just saying that you have to be in this clinical role in order to be successful, but also making sure that when someone walks in and they see me sitting here, it's not just that, oh, here's someone and they're just going to tell me a good story to get me in here. I'm not telling you a story, like I'm telling you the facts about what reality is for us. And I was like, and sharing like, either you can go out and prove all these people right and continue these things, or you can stand out and make a difference. Another thing that I've noticed, like outside of Black History Month, even just being here in Lexington, there's Spanish speaking meetings or meetings for, certain things, but there's nothing for like, hey, here's a African-American or people of Black culture meeting where we can discuss these things separately. Or even like, I know personal experience, like my home group, we discuss a history topic every month and sharing some of these things, like how has the Black culture played a part in these anonymous programs in AA, NA, and what they've done to grow these things. I think a lot of it is just so much as we continue to not engage in bringing this topic up. It's like, hey, we have our month and the story, and I think even so, like, as long as we continue to advocate for these things and present these topics, they're not going to go away. If we continue to show up and, continue to fight for these things for longer than a month, 30 days is just the beginning. Even with treatment, your mind change is just starting. So even if we're beginning to take these things on and carrying them out through each month, so on and so forth, and bringing up the small topics, they turn into bigger discussions. So as far as care deserts, even making things more accessible to people, like operating on the Zoom platform, making some of these things like virtual to where, hey, I don't have the transportation that I can get to this treatment center every day, but, I'm dying to engage in treatment. Again, the resources, like as far as getting more Black therapists or people, or even so much as educating our white counterparts in how to deal with, hey, you're going to have this person across the table and they just think like, oh, this white girl don't know what she's talking about. And I've experienced that. Like, AJ, I'm not going to go talk to this therapist. She can't relate to me. And learning how to have a civil conversation with these people and educating ourselves in what mannerisms and learning how to, not say like it's black and white across the board and this is what treatment you're going to get, but learning to focus more on the individual and who I have sitting across from me, and being able to have a conversation with them as to where they are going to get the most out of their treatment, rather than just say, hey, this is what I do for everybody and this is the end of it. Just bringing more topics out to discuss and present. Like, I love that we're doing this webinar today, and I'm really grateful. I was super nervous about being here, but like, now that we're here, I'm really excited, because doing things like this each month to bring the hard discussion up and have, so many faces that are here and ready to discuss these things, and just knowing that, it's not just a Black face that's going to talk about this, like spreading the awareness and knowing that, hey, I don't care what color face you have, we can all discuss this, because the change starts like right here, right now. So I think that's all I got for there.
And I just had one additional thing to add is, as leaders, we have to push back from just doing Black History Month events. I know for what I do actively is all the summits and conferences when people are asking me to participate, I make it my business to make sure that there's other people who look like me that who are going to be presenting. So all the people that I'm meeting now, again, because this happened, a summit's coming up this year, and a colleague that I started working with more and more who looks like me is going to be presenting at another summit this year that I'm started engaging on these platforms. So don't be surprised if I reach out to Sophie and say, hey, I was asked to do this. I would love for you, Sophie, to be a part of this. And AJ is a great person. Or Jay, how about you get on this? We have to start saying, not in February. The other thing is, I tell people, I don't want an award in February no more. Don't give me an award in February. I have had an award in February, and actually I've been triggered and traumatized because then I got disciplined months later or something that was reckless and not true. And I was like, oh, but I got an award during the 28 days that you get to celebrate me. So nope, I ask people, don't do that, because it's not fair, because the work that I do in February, I do in March, I do in April, I do in January, I do in May. So making sure that we say, no, it's not going to just be this month. We're going to do this again. I actually, a lot of people I met on UNSHAME, I'm being asked to be in other spaces outside of February. So I'm always saying, hey, I'm available every month outside of February to do something, to speak to something, to be a part of something. It's a lot of work for us, but if we want to see a system change, we have to be at the table. Get into the policies, you guys. Like, if you want to see a system change, find out who's leading these efforts. Why didn't I see Jay's name on this list? The folks who are attending this, they asked for people with lived experience that could speak to these issues. And I didn't see AJ, and I just saw her, and I saw her experience. And Sophie carries a lot of weight to the game with her experience. So I'm questioning people. Ask them, why aren't you engaging these folks? Ask them, why weren't they on this webinar? Start challenging folks to be engaged in these conversations that aren't usually in these conversations, so that we can do it outside of February.
Love that. Thank you all for that. One more question, and just a heads up for all the attendees, we might go over a little bit, but I think it's important that we kind of end on this note of highlighting programs or success stories of individuals that are doing well in the BIPOC community, in Kentucky, or just in general in this country. So I'm throwing it out to the panelists. Whoever would like to jump in first, please share your experience with that.
Well, here at Voices of Hope, I'm working under the Kipper grant, which is a grant specifically for the BIPOC community, and for linkage to the quality care and quality harm reduction services that we spoke of today. So I'm going to be on the front lines of being out here on these streets, girl, giving our community the resources and information that they need. And I'll be able to do it, as Sophie in professional boundaries, but as Sophie, and I'll be able to meet people where they're at, but people from my community. So they'll be able to see me and see, we all can do this.
Are there others who'd like to highlight either a success story, of somebody that has gone through a program that was specifically tailored for BIPOC communities, or if you know of a program?
I'll hop in real quick. I did recently have the opportunity to work with Damon Williams out of Louisville, Kentucky. Yeah. And he has a program on Omni Recovery. I think he has a couple of recovery homes that I think is absolutely amazing. He's had some challenges. Got to work with him through some of those challenges in terms of just kind of getting the word out there and really kind of helping him to build a team around him that he needs. And yeah, so I think he's absolutely a great. And then another one here in North Carolina, a colleague of mine, Risha Holly. She's certainly been an inspiration because she's actually put on a mental health expo in rural North Carolina. You talk about care deserts, right? I feel like rural North Carolina certainly meets that definition. And she puts on this mental health expo right in the middle of a historic neighborhood. Historically Black neighborhood in Eastern North Carolina. And they're on their second year. And every year it gets bigger and bigger, and the third year is going to be bigger than that. In fact, here recently, because of the success of her expo, she's been able to do clothing drives for the homeless as well here in the month of both January and February this last 2 months. And so we know the work is out there. We know that folks are doing the work. And again, it's really on us, those who have the platform, to highlight those individuals doing the great work, to ensure that the next opportunity that we get, as Sharita said, that we're bringing those individuals with us and we're mentioning their names in spaces that they may not be in, to ensure that that work continues to carry on.
Thank you all. Oh, go ahead, Sharita.
I'm so sorry. Jay is absolutely right. Omni, please don't tell him. And then we got like 100 people on here, okay? Don't go back and tell Damon I did not mention. Omni is a fabulous organization where we're trying to integrate in the hospital system through MCO. They are doing some amazing things, but did y'all just see how we were able to identify just by hand? That is not okay. We have so much work to do in these spaces. And a lot of people tell me, they hear it when I walk into a space, I am not your token. So when I tell you my 3 new friends on this platform, I will be reaching out, because this is how we do the work. This is how we get in those spaces. And I'm excited to be able to take this and keep going and make February go throughout the whole year.
Love that. With that, we actually had a question from Megan. Is there a way we can reach you? She's talking about all of y'all, to invite you to our events, meetings, and trainings if you're willing and available. If you want to go ahead and y'all want to drop your information, contact information in the chat so that Megan and others know how they can reach you, I think that would be wonderful. Thank you all so much for sharing your experience, your knowledge with us today. I think this was a great start to this conversation. And I think we've all been challenged now to bring this out to beyond February, into the rest of the year. I'm going to throw it back to Ashley to give us some final words before we log off.
Thank you so much, everyone, for attending. This did have such a good turnout. I think we had up to 109 people on at one time, which was great. But thank you so much to our panelists. I learned so much. I'm sure so many people learned a lot, and also just the inspiration. Thank you for personal lived experience that was shared. I know that can be vulnerable. So thank you. That was extremely inspiring. If you want to get in touch with any of the panelists, or you have questions about our campaign, my email is on here, ariley@shatterproof.org. If you're interested in sharing your story, becoming a community-based organization, please reach out to me and we will get connected. So thank you so much for attending.